Injuries can happen anywhere at any time. And they don't just happen in industrial settings. Office workers can also be hurt on the job. Knowing how to help a coworker who's been injured can mean the difference between temporary or permanent disability, between life and death. That's why everyone should know basic first aid procedures.
In this program, you'll learn 4 emergency action principles, first aid basics, and several first aid tips for specific injuries. With this knowledge, you'll be more prepared to help in an emergency.
Basic first aid is not complicated. The difficult part is remaining calm enough to think straight.
The best way to handle an emergency is to be prepared for one. Learning the 4 emergency action principles is a good start.
First, survey the accident scene. Second, send someone to call emergency personnel or EMS. Third, calm yourself and gain the victim's confidence. And fourth, assess the victim's condition and do a head-to-toe survey. Mike is surveying this accident scene to make sure Darla is not in further danger and that it's safe for himself. When surveying any accident scene, look for objects ready to fall, smoke, electrical wires, and nearby liquids or chemicals.
If there were a potential hazard, Mike would have to move Darla. This could be very dangerous if she has a spinal cord injury. You should never move a victim unless he or she is in immediate danger.
Mike's next action is to call for help. Some companies have in-house emergency medical systems, while others use their local municipal system. Whichever your company uses, notify them immediately. If you come upon an accident scene and no one is nearby, try shouting for help. If there is no response, perform the most necessary first aid, then reassure the victim you'll be right back. Run to find the closest person to send for help, then return to the victim immediately. Take a deep breath and try to relax.
Remaining calm not only helps you think straight, it also reassures the victim. Your facial expressions and other reactions can help or hinder a victim's state of mind. If you panic, they will panic. Whether the victim is conscious or not, reassure him or her that help is on the way.
It's important to find out what is wrong with the victim and the seriousness of the condition. Before Mike begins to check Darla, he gets disposable gloves from the first aid kit. Gloves protect you against any possible bleeding or infectious body fluids. If gloves are not available, look for something waterproof that you can use as a barrier between your skin and the victim's.
Now Mike is ready to check Darla's airway. If Darla were conscious and alert, Mike would know that her airway was open.
However, Darla appears unconscious and doesn't answer Mike's questions, so he needs to check her airway. First, Mike looks inside Darla's mouth for foreign objects. If there was something in the way, Mike would have to try to remove it. Mike is careful about how he checks the airway. Mike will use the head tilt chin lift method to open her airway. Do this by pressing down on the forehead while tilting the chin up. This action pulls the victim's tongue forward and out of the airway. To check Darla's breathing, Mike uses the look, listen, and feel technique. Turn your head to the side and put your ear near the victim's mouth. Look down the chest for a moment, listen for sounds of breathing, and feel for breath on your cheek. In this case, Darla is breathing. If a victim is not breathing, first pinch the nose, take a deep breath, and place your mouth over the victim's mouth, making sure you have a tight seal. If you have access to a pocket mask device, place it over the victim's nose and mouth. Give 2 full breaths for approximately 1 second each, allowing the chest to deflate after each breath. If a victim is still not breathing or moving, begin chest compressions. Perform the compressions like this. Place the heel of one hand on the victim's lower sternum. With your other hand directly on top of the first hand, push down 1.5 to 2 inches. Compress the chest 30 times and then lift and tilt the head back again for 2 more breaths. Go back to 30 chest compressions, then 2 more breaths. Continue this until the victim gains consciousness, an AED arrives, or EMS personnel take over. When the victim is breathing, move him or her into the recovery position on his or her side. Use something to support the head.
This prevents the person from choking on saliva and helps keep the airway open.
The next part of principle number 4, victim assessment, is to do a head-to-toe survey. Starting at the head and working down to the feet, look for signs of bleeding, protruding bones, a medic alert bracelet, or anything else that might be a clue to the victim's situation.
Fortunately, Darla does not show any signs of bleeding or broken bones. So Mike continues to monitor her breathing and reassures her until emergency medical services arrive.
One of the scariest emergencies to handle is when someone is bleeding a great deal. The sight of blood makes many people feel like panicking, but by being prepared, you can stay focused. First, remember the 4 emergency action principles. Survey the scene, send for help, remain calm and reassuring, and assess the victim. Now, Nick reassures JT that help is coming soon and begins an assessment of JT's condition. Because JT is crying out, Nick knows he is breathing, so his airway is open. Next, Nick does a quick head-to-toe survey. He doesn't see any other injuries except for the deep gash in JT's arm. Since JT is bleeding severely, Nick knows he needs to act fast. Direct pressure, although it may cause pain, is usually all that is necessary to stop bleeding. Cut or rip clothing away from the wound if possible. If you have a first aid kit, put on disposable gloves and use a thick, sterile gauze pad to press on the wound with your whole hand.
If you don't have a first aid kit, do the best you can to protect yourself and help the victim.
If you do not have gauze, you can use a shirt or clean cloth on the wound. If you don't have gloves, look for something waterproof to use as a barrier. With today's danger of HIV and hepatitis, be careful around blood and body fluids. When a victim is bleeding heavily, it's important not to remove blood-soaked gauze or cloth because this can disrupt the blood clots that may have already formed. If there is more blood to be absorbed, just add more gauze or cloth on top of the first dressing. Even with direct pressure, JT's arm continues to bleed, so Nick elevates it above the level of his heart while continuing to apply direct pressure.
In most cases, direct pressure on the wound and elevation will stop the bleeding. However, when these efforts are not enough, severe bleeding may call for direct pressure at a pressure point.
Pressure points are the areas on your body where a major artery runs, supplying blood to your extremities. Pressing on one of these spots pins the artery against the bone and slows the flow of blood, much like standing on a garden hose.
If a person is bleeding from the arm, use the pressure point on the inside of the upper arm.
Grasp the victim's upper arm and press the inside of the arm against the arm bone.
If the person is bleeding from the leg, press on the crease of the groin.
Place the heel of your hand to the side of the groin and press down firmly. Continue pressure to control the bleeding.
Most injuries involve some degree of shock. When someone is losing a lot of blood, shock is even more likely.
Shock occurs when the circulatory system fails to deliver oxygenated blood to all the vital organs of the body, primarily to the brain. Look for these symptoms of shock: pale or bluish skin and lips, cool, wet skin or heavy sweating, rapid breathing and pulse, dilated pupils, dull, sunken look to the eyes, thirst, and nausea and vomiting.
When shock is severe, the person may lose consciousness. Although shock can kill, there are simple steps to treat it.
The most effective and often used prevention and treatment of shock is to have the victim lay on his or her back and raise the legs 8 to 12 inches from the ground. Use any available object to support the legs. This allows blood to travel straight to the person's vital organs. Sometimes it is important not to raise the legs at all. These situations are if there is a leg fracture, when a person has a head or spine injury, if a person is having trouble breathing. If there's a chest-related injury or illness, the victim should instead be placed in a semi-reclining position to make breathing easier. If it appears the person may vomit, lay him or her on one side so the fluids will drain and not cause choking. Remember, after dealing with an injury involving blood, to wash your hands thoroughly before touching your mouth, nose, or eyes, or before eating or drinking anything.
Even if you were wearing gloves, wash your hands after removing them.
Often, it's difficult to tell whether a bone-related injury is a fracture, dislocation, or strain. Fractures are breaks in the bone. Dislocations are bones that are separate or displaced from their normal position at a joint. And strains are tears in the ligaments, tendons, or other tissues at a joint.
Since it is hard to tell which type of injury the person may have, treat it as a fracture.
Pam has just found Mary, who has fallen on the stairs. Mary's arm appears hurt. Pam asks Mary if she's okay, then yells for help. Next, she tells Mary to stay calm. A co-worker answers Pam's call, and she sends him to call 911. She also asks the co-worker to bring a blanket to keep Mary warm and a first aid kit. Pam was able to go through the 4 emergency action principles quickly. She surveyed the scene, sent someone for help, reassured Mary, and did a victim assessment. Some fractures are classified as open, meaning the bone has pierced the skin and has caused bleeding.
You will have to care for the bleeding as well as the broken bone.
Some fractures are classified as closed, meaning they are underneath the skin. These are more difficult to diagnose, as in Mary's case. However, there are a few sure signs of a broken bone. The victim felt the bone snap. The victim feels a grating sensation of bone ends rubbing together, and the area of the injury is obviously deformed. If you are unsure, treat the injury as a fracture. While waiting for EMS, splint the bone in order to immobilize it.
This keeps bone fragments from moving, which could worsen the break and painfully pierce the skin around the fracture.
Be creative when making a splint. Any of the following items could work: boards, straight sticks, cardboard, rolled newspapers, and pillows or rolled blankets. Make sure the splint extends beyond both the joint above and the joint below the broken bone. Place some padding, such as cloth or towels, between the splint and the injured body part. Tie the splint in place in 3 or 4 places, being careful that the ties aren't placed on the location of the injury and that they don't cut off blood circulation. You can make ties out of neckties, strips of cloth torn from shirts, handkerchiefs, belts, string, or rope. Mary is showing signs of shock. Since there's a chance she may vomit, Pam lays her down carefully on her side, making sure to protect her arm. Pam also covers Mary with a blanket and continues to monitor her.
Most first aid tips are common sense. Call for help, stop the bleeding, don't move someone with a possible spinal injury. But how do you handle electrocution and electrical injuries?
Your first instinct may be to run to the victim, but wait. If the victim is still in contact with the source of electricity, don't touch him or her, or you could become the next victim. First, try to switch off the electrical current. If you can't find the control panel or are not able to reach it, push the victim away from the source of electricity using something that is insulated or non-conducting, such as a broom handle, a piece of wood, dry rope, or dry clothing. Make sure your hands are not wet or that you aren't standing in water, since water is an extremely good conductor. Once you have separated the victim from the power source, call for help and begin to check the airway, breathing, and circulation. Remember to be careful in case of a neck injury. A victim may need artificial respiration or cardiac resuscitation. While wearing disposable gloves from a first aid kit, perform a head-to-toe survey looking for any bleeding or burns. Second and third degree burns are a common result of electric shock. Second degree burns will show redness, swelling, and blisters. Third degree burns have a white or charred appearance. Cover all burned skin with a dry, sterile dressing. Elevate an arm or leg that is burned above the heart to lessen pain and relieve shock. Keep the victim warm and reassure him or her until EMS arrives. Other types of burns you may have to treat are chemical and thermal burns. Chemicals can continue to cause damage after initial contact since they react slowly to the skin layers. Most chemical burns can be relieved by flushing the skin with lots of water. If possible, remove any clothing or jewelry on which chemicals have spilled and continue flushing the skin with water. If someone gets a chemical in their eye, flush the opened eye with water until EMS arrives. Care for possible shock and monitor the victim until help arrives. Thermal burns may be from hot materials, scalding liquids, steam, or flames. The symptoms are the same as described for electrical burns. If the skin is not broken, first-degree burns can be treated with cool water. Then cover with a dry, sterile cloth. A moisturizing lotion can be used after the skin has cooled. For second-degree burns, use cool water to relieve pain, then cover with a dry, sterile cloth and get medical attention. Do not break the blisters. If the person has third-degree thermal burns, cover the area with a clean cloth and get medical help. Do not attempt to treat the burn. Keep the victim warm and treat for shock. You may not know the specific first aid for every emergency, but by remembering the 4 emergency action principles, you can handle any situation until help arrives. Number 1, survey the scene. Number 2, send for help. Number 3, remain calm and assuring. Number 4, assess the victim. When you assess the victim, always start with the airway and breathing. Then follow up with a head-to-toe survey. With this basic knowledge, you'll save precious time that could save a life.